Miller, and actually I'm only half of the integrated health treating team. My wife in the back is a registered nurse. She does all the patient education. She's actually the one who sits down with them, takes them through everything, and is patient. I like the labs, but we have to kind of figure out, first off, who knows what a biofilm is? Please, everybody raise your hand. Good. Now, since you know that, my job today is to define a biofilm, what its life cycle is, boring stuff, identify the bacteria that cause the biofilm, and then start to show you what I do to treat it. And at the end, I do have a case study that we show how we have eliminated the biofilm using both the enzymes, and I use some other stuff as well. So another question I have, who has a hard time, and this goes back to one of the other presenters, as doctors and clinics, we cannot help others if we actually don't make a profit. Our business requires profits to run. If you're broke, you're out of business, and you can't help anybody with your knowledge. So with that being said, who has a hard time educating their patients on getting them, on understanding why they need the lab and explaining that to them? Anybody have a hard time doing that? Just, okay. So I can kind of gauge where we're at. Biofilms are not new. They have been known for a very long time. The father of biofilms, if you look in your notes, there's a link to this video of Dr. Bill Costerton. He is known as the father of biofilms. This video is actually 12 years old. And I was very interested when I watched this video. He talks about how in medicine, we're about the only type of microbiologist that still uses cultures. And you'll find out why the cultures, especially with biofilms, are kind of not very good. Because there are technically 5 stages to the biofilm, and you can really only pick it up in one, but I'm getting ahead of myself. If you want to take a deeper dive, y'all changed my slides. You're supposed to see Dr. Bastidas again. This is actually a link to his video, and he does a great dive into the biofilm as well. And so I'm just going to climb on the shoulders of giants. I can make it really scratchy. Here we go. How's that? I can do it on the tie. Try that. All right. So Dr. Bastidas does this, and Transformation actually has them right in their video file library, and it's a great resource. So if you forget everything that I say, you can go back there and even get some different stuff. So here's the clinical definition as defined by online library wiley.com. And the thing I want you to pay special attention to is the word extracellular polymeric substance. And so we will talk about what that actually is. As I explain it to patients, if you tell a patient that, they're going to look at you like, huh? I explain it as either like slime, snot, whatever you want to say. They understand that. They understand that, oh, it's coated in slime and we have to get to it. So now we're going to look at, this one's a kind of a lengthy slide, so we're going to spend just a little bit of time here. But as Dr. Costerton said, this first stage of the life cycle is known as the planktonic stage. This is when we can actually culture the bacteria. It's only when it's in this free-floating state that we can pick it up in the bloodstream. And so you got to kind of think about, let's give bacteria some, should we say, let's give them characteristics of people. So in this stage, let's talk about teenagers, since I have teenagers. In this stage, everybody's hanging out and going to the parties, and they're kind of trying to see who's doing what can we do, and then they start to form their cliques. This is that second stage, the initial reversibility attachment. So in this stage, if you have cultured them, caught them early, you can use antibiotics. Antibiotics will attack this, and they do a pretty good job. I personally don't use antibiotics. I'm a DC. In the state of Indiana, I cannot do that. But our medical doctor friends who are, how many people in here treat biofilms? Exactly. How many use antibiotics? Good, I don't even have to talk about it. Forget what I just said. But so you can also use herbs, and we will talk about that. And more importantly, the same thing that we've been hearing about in multiple of these presentations is protease. Because protease actually takes the adhesion principles of this and starts to reverse it. So then they form their cliques. Now all of a sudden they start to hang out together, and this becomes where we can start to actually visualize the biofilm using electron microscopy. There's a couple other techniques. I don't have that kind of equipment at my clinic, so we'll talk about how I identify these things. So at this stage, they've gotten married, they've hooked up, they're starting to proliferate, and they're getting more and more and more and more. And so at this point in time, they are actually exchanging genetic material. This is how you can have somebody come in and they have that antibiotic resistant strain, because when they're in this portion, they actually do exchange genetic material. At stage 5, they've grown, they've populated, and now all of a sudden you can have little bits breaking away and starting to form new colonies. And that's how you can get them to go into the small intestine, that's how you can get them to go all over the place. The going from the dental plaques and moving on, going from knee implants and moving on. This is that migration portion. Now you can get them because they do get free, and then you can kind of get them there as well. That's when they can be cultured. But you got to remember, you now have a reservoir. So how many of you use medical symptoms questionnaires? We do one every month with our patients. How are you feeling? How are you doing? And for people, I do them with my chiropractic patients because my chiropractic patients will do really well. And then all of a sudden, I'm just going through that again. I'm just cycling through it again. And I'm like, well, we really need to have a different discussion, because the chiropractic adjustment, in my case, is pretty much biomechanical. I want to work on movement with you. I want to give you range of motion. I want to give you that freedom. But you have a different issue going on. So now we have to have a much deeper conversation. So when we see that, it's very interesting that you can think of it like towns, cities, whatever, and people break off, move out, they go to the suburbs, and then they start doing the whole thing again. So, first thing, I live in the Midwest. I live in Columbus, Indiana. We have a practice in North Vernon, Indiana. North Vernon, Indiana is your Midwest redneck. If I wasn't here, I would be in a tree looking at deer, hopefully. So what we see is, what does this sound like? In my area, this is every person's diet. Highly refined foods. They're running through the gas station. They all work factory jobs. They're hitting the insert fast food restaurant here for lunch, and they all feel like crap. So that is when I pull that lovely lady back there in for a consultation, because we have to have a heart-to-heart, because this patient isn't going to get better just doing chiropractic. And if they don't like what I say, we actually break the relationship right there. Because at that point in time, I'm taking their money. If you don't want to listen to what I'm saying and you don't want to do what I want you to do, we got to meet them where they're at. There is a give and take there. But if they look at me and say, my diet's just fine and I'm doing great, I'm sorry. At this point in time, I'm stealing from you. So here's another doctor. You can go there. They'll give you your NSAIDs or whatever you want. And I leave the door open. We are always here. If you get to the point that you feel like you need us, we're here. And we leave them our emails. They can contact us in any way, shape, or form they need to contact us. Because as a doctor, what does doctor mean in Latin? Teacher, exactly. We are teachers. So, one of the good things I will say, my 20 to 30-year-olds that are coming in are a lot more receptive to the food message. I have a harder time with my 50-year-olds who in the mid-70s got inundated with fructose and high fructose corn syrup, because that's when they started to introduce that into the American diet on a grand scale. And we think, well, we've lived this long with this stuff. How is it hurting us? It's a slow poison. So it kills you very, very slowly. And then, of course, we have to have the discussion on insulin, and we have to have the discussion on how glucose stimulates, and then fructose just takes the check valve off of it. And that's a whole nother, sidetrack. So how do we detect this? How do you know if all of a sudden these guys are mature and they're all holed up at home? How do you detect that? What do you use to start to get into what's an indicator that you have a biofilm? Well, once again, we're back to the questionnaires. Does a person come in and you see a nice little cycle? Or, hey doc, I was taking my antibiotics from XYZ-MD and I felt great. I did my 10 days. And then as soon as I got done with my 10 days, I was done and I lasted about a week. And then it came back. Well, that's also another indicator. So, since we know that it can only be found in this on culture, we have to use different tools. And, we can't tell the future, but I'm so glad I didn't live before the age of DNA testing and PQCR. We'll talk about that here in a little more. But that's what has to happen. And so I don't have access to these things, and I wouldn't even know how you implement them on a patient, to be quite truthful with you. I think when you do the electron microscope, for my doctors in here, are they taking like a biopsy and looking at that? Because I know they're not sticking the microscope down their throat. So regardless, I'm pretty sure this is out of all of our price ranges, because that's pretty much used in laboratory settings. So what do we have? Well, I run a stool test, actually with my functional medicine patients, and we'll get a little deeper into this in just a moment. I actually run 3 tests with all of my functional medicine patients. But we start out with the stool test. So when you're talking to a patient, the biggest thing to actually get through to a patient is you can have GI issues without a GI problem. And we all understand that. The patient does not. They don't understand that at all. Or at least mine don't. Yours might be better educated. So it's showing them how this happens. Microbiome Labs has a very wonderful little video that they let us all use that explains leaky gut, and it shows how you can have the inflammation caused by what you eat and doing stuff like that. I love educational resources like that to show patients. They understand it. So I'm sure you've all read this by this amount of time, so we'll go to the next one. The biofilm leaves clues. You all have this slide in your little QR packet, so you don't have to write everything down. But this is actually a scan out of my cheat sheet. So I love the microbiome. I have spent the last probably 6 or 7 years really studying the microbiome. And so my wife, Jessica, loves hormones. Unfortunately, she has a much larger impact in the beginning with making people feel better than what I do. But we do have a way of bringing everybody together at the same time. And that way, as they start to come off of their hormones or their pellets run out or insert whatever therapy here, hopefully we have gotten their short chain fatty acid producing bugs online. Hopefully they're eating enough insoluble and soluble fiber that they support those. Because if they're not, then you haven't done the first R, which is remove all the offending stuff. And if they're eating crappy food, they're just going to go back to the way that they were. So if you're not doing lifestyle medicine and helping, leading the patient to what these changes mean to them, if I can do it in North Vernon, I almost guarantee you guys can do it here or wherever you guys are at. So, pay attention. You see these say biofilm former, and then you see where I say BBE. I have to give a big tip of the hat to Amy for giving me that little piece, because that was the piece that I was missing when I was attacking biofilms. So here's the QPC voodoo that the GI map does. I don't care what stool test you use, Genova, Microbiome Labs. I love the GI map. And the reason why I love the GI map is not only for this portion of it, but it also gives you steatocrit. It gives you secretory IgA. It gives you antiglidin IgA. I also do a zonulin on every person with the GI map, because I don't know how many times I've heard, gluten doesn't affect me. I can eat as much gluten as I want. And the antiglidin IgA and zonulin markers say, you can't. And so if you can get them, I say, once again, I have to give Jessica the credit. She sits down and does the education. She goes through the elimination diet with them page by page, because I'm off adjusting the next person. As a doctor, here's a business tip. As a doctor, as a chiropractor, I'm only good in 2 areas in my clinic: X-ray and adjusting. That's as a chiropractor. As a functional medicine doctor, because I have her, I am good at saying, here's the education, here's why. She's going to bring you through the rest of it. That's going to take an hour. But you have to spend that time with them. They connect with you at that point in time. She's prettier and nicer than I am, so they all listen to her too. And for some reason, RN carries more weight than DC when educating. And I'm okay with it, because she gets it through, so I don't have to worry about it. Designs was supposed to supply you with this handout. These are the biofilm forming bacteria on the GI map. So if you run a test and these guys are out of whack, are high, and you have this in your slides, the slides are all on the QR code. But if you have any of these, you have to sit down and have a heart-to-heart, because now the patient is looking at a chronic infection. And the thing that is really weird is the person will come into you and their first GI map doesn't look that bad, typically. And I chalk that up to the body's ability to actually adapt. It wants to heal. It doesn't want to feel bad. It doesn't want you to feel bad. And so it does a lot of good covering up. And of course, you know, what's everybody on? A PPI, and I'm popping NSAIDs like they're Pez, and where's my Tylenol, blah, blah, blah. So the body does a pretty good job of masking quite a bit of it. And then what happens? I mean, we're all functional medicine practitioners in here. So what happens when you start to peel away the onion? What happens at the second GI map? Oh yeah, looks like hell. And the patient, typically the patient for us, and you got to have the talk with them. I'm sorry for what I'm about to do to you, but it's the path you have to travel, and it's going to suck for a little bit. But only a little bit. So then what happens is we have that talk with them that you're going to feel like crap for probably about a week or two. If you herx, you're going to feel like crap really bad for quite a bit longer. I generally, if patients are herxing on me, I ask, can you stick it out for 3 or 4 days? And if they can stick it out for 3 or 4 days, 90% of the time, my patients come out the other side and they're like, yeah, day 3 was rough, doc. You were about to get a call. But they come through. If they don't, we back off. We go to something a lot lighter, and my analogy to them at that point in time is, this is like lifting weights. We put you at the 200-pound bench press, you don't have the arms for it. So we're going to roll you back to 100 pounds. And then we're going to work back up, because I had one lady actually was a cousin of mine. So she has my personal number, and she called me at like 4 in the morning on a Sunday. I'll edit it. What did you do to me? What do you mean? She goes, I haven't left the bathroom, and thank God my sink is really close to the toilet because it's simultaneous. And I go, you're herxing. I backed her off immediately since it was that bad. And then we worked her back up, and she's fine. So, how do we cull these things? What are the biofilms' weaknesses? And so when we talk about this and we look at this, one of the things that I forgot to foreshadow in the beginning of this was, what's that EPS? What's the snot layer made out of? Anybody know what that's made of? That's right. Proteins, fats, polysaccharides. So we actually have, somebody else even said it earlier, that what its strong suit is also its weakness. Because what can we use to degrade proteins? Enzymes. And once again, this was one of the things that was a game changer for me. And I'm going to do a little, they didn't ask me to do this, but I will say this. I have taken proteolytic enzymes for 20 years now. My first experience with proteolytic enzymes was when I had 4 wisdom teeth cut out. Single practitioner, can't afford to be out for a long time, can't go get a tooth cut out, take a couple days, tooth cut out. So I went in and I was like, if all 4 are there, you're taking them. I'm going to blow 1 weekend, and that's all you get, doc. And he was like, well, okay, you're going to take off Friday. You're going to give me 3 days. And I said, I can do that. So I go in, he puts me under, takes out all 4 wisdom teeth. I think this one actually had to be busted into pieces and extracted. I did not take any narcotics other than the one narcotic they gave me before I left. And I was on essentially the 2 proteolytic enzymes 3 times a day, and I started that before I went in to get my teeth extracted. I go back in a week later, and we're talking, how you doing? Doing great, you know. He goes, well, do I need to refill your script? I was like, no, I only took 1. He goes, really? You're doing that well? And if you want another great testimonial for how that does for injury, talk to my wife. She will share what she wishes to share about her experience with proteolytic enzymes, and I think you will all be sold. But he looks in my mouth and he goes, what, you're not in any pain? And I'm like, no. He goes, you have dry socket in all 4 of your sockets. I go, what do you mean? He goes, well, I was going to remove your stitches, but they're all gone. He goes, everything's out of there. He goes, I got to go irrigate these things now because there's crap in there. And he goes, how are you not in pain? And I'm like, I don't know. And then I started to talk to my sales rep then, and he goes, honestly, it's probably the proteolytic enzymes. And I was like, well, I've heard that dry socket really sucks. I'm not going to stop, so give me more because I don't want to know what dry socket feels like, and I'm okay with that. So we need to attack this here. We have to wear this down. I had an interesting call with Dr. Bastidas, and I was like, do you think this thing layers like paint on a car? Or do you think it's just this massive blob? And he goes, I am not sure. Have you come to a better conclusion on that? Because I'm just a simple clinician. You're the researcher. Blob. So we're 2 blobs. So that's just a big mass of cells in snot, and you've got to peel it away. So, Amy, you made me put all the things about protease in here, and everybody else has covered them. So I will cover them a little bit, high level. But if you want to degrade these extracellular polymeric substances, you have to use a protease. We're going to go into the protocol here in just a second. But I really want you guys to pay attention to the anti-inflammatory properties. If you have people, I put my chiropractic patients on protease because it works. And I'm not destroying their gut. And I'm not breaking down their liver. And they feel better. And so I am your typical klutz. So I stay on it. My most recent accident was mountain biking through the Muscatatuck Park. You guys don't know what that is. But hitting a root, going down, and banging myself up. And I really didn't say much about it until Jess sees me that night, and she goes, "What happened to you?" And I was like, "Oh, I went down, I caught a root, and it just bang, threw me right down." And she goes, "Well, look at your back." And all back here, I had a big hematoma already that had kicked up, but it didn't hurt. And how many 54-year-olds do you know that are going to go down hard and go to work the next day, not really pay attention to it, and just go on? In my area, not a lot, because they are all super inflamed and super sick, and they eat like crap. They also don't sleep. So the other thing to think about, I've heard it a lot today, taking the enzymes on an empty stomach. And I will say this, I use it in two different ways. If I have a person and they're early in functional medicine, if you don't want the bad bacteria, the dysbiosis, if you don't want those things to keep proliferating, I put all my patients on 2 of the protease, 2 of the gastro, and 2 of the digest when they eat. And that is so, because we all overeat, that is so there's not a lot left over for those bad bacteria to eat on. So it's kind of starting to give them a little bit of a fast. Once they start to feel better and they're actually losing a little bit of size, I then switch them to I want you to take those now between the meals. If you have any type of digestive upset, if you start to get your reflux back, if you feel like reaching for a Pepsid, you're going to have to do it both ways, and you're also going to have to look at what it is you can't give up that you keep eating and offending your body with. And around our state, it's beer. So I'm German. My mother's maiden name was Bergmeyer. My father's name, Mueller. And I love beer. I don't drink it anymore because it doesn't like me. So supplemental enzymes attack those biofilms. And the big thing is, what does eating, just the simple act of eating, even good food, what does that trigger? It triggers LPS. So it only makes sense to make sure that, I speak to my patients very simply, if you're above the age of 25, you need to think of your body like a classic car. And your classic car needs help. The more love that you give your classic car, the more miles you're going to get out of your classic car, and it's going to treat you well. And when you want to put the hammer down and run like a scalded dog, you can, and not feel it for the next 3 days. But if you don't, and you let this stuff build up, how many of you have ever not, well, we're in Houston. How many people shovel snow once a year or twice a year? How do you feel after you shovel that snow once a year or twice a year? Well, you look pretty healthy, so you're pretty thin. In Indiana, I'm going to the garden, and then they come back out of the garden and they're like, I can't move, my back's fired up, and this, that, and the other. And I was like, yeah, if you're going to go move 200 bags of mulch once a year, and you're not thinking about that when several months ahead of time, you're going to do a lot of damage. And you're going to come in and see me for about 10, 12 visits. Health benefits of proteolytic enzymes, biofilm eradication. Let me see what my notes say that's different from what we've heard. I was supposed to talk about the delayed onset muscle soreness on this one. Already covered the wisdom tooth. I did break my neck last year in Ocracoke Island. Mother Nature decided that she wanted to pile drive me into the sand. And I got stoved up, and I looked at Jess, and I'm like, hon, it doesn't feel right. I got a little cracking and popping in there, but we're on Ocracoke Island. Who's ever been to Ocracoke? You got two choices. You're either helicoptered out of there, or you've got a multi-hour drive. And this was on like Tuesday or Wednesday. And I'm like, everything seems to be working. I know what day it is. I know who the president is. Kind of doing that self-assessment that I should have just had her do on me, but I didn't tell her how bad it really hurt. And the hands were a little numb and stung, and I was like, I did tell her I hurt my neck, but I didn't say how bad. And the next day, I was like, oh, I could barely move it. And I was like, okay, we're going to go do some yoga. We're going to loosen it up. And it just didn't go away, but it didn't get worse. So then I went home, and then I had x-rays done, and I had broken C5, C6 lamina. And it was like, it's too late now, so I don't really do anything. It's stabilized. All right. But I pretty much, and I told Amy about this one too, and I was like, I was able to operate and still have a good time. I mean, it hurt, and it's supposed to hurt because you don't want to do that again. But And that's purely due to the way that controlled my inflammation. I don't have a lot of extra osseous bone growth yet. I keep watching it. That's actually something that's going to be a personal case study. I want to see if that keeps that from getting that big set of, end-plate hypertrophy with the disc gone, with a lot of osteoarthritis. I'll be interested in seeing what happens, because medicine can't take that away anyway. So what do we have to determine the use of these? You have Bacillus as a biofilm former, Enterococcus, the list is there. Diagnostic Solutions Laboratory has that handout for you. Did they include that? Did they give that to you, Amy?
So I had put so unfortunately Mike, their rep, is in Tampa, so he was not able to make it because he was impacted by the storm.
He's swimming.
Yeah, he's doing, his house is good, just no power and no airports, obviously. But I did put handouts out last night that they had sent, because I had to ship their stuff back. But if we don't have it, I will make, no, it's not. I didn't see it in the bag. I saw there is a handout
Everybody
in the bag, but
bug Amy, and she will be able to probably email you that file.
Yes, that's what I was going to say.
easily.
We will get everybody with the links. We'll include that.
And the other thing is you are looking at one page. Who's used this before? Who's used the GI map? Who loves the GI map? Who hates the GI map? Oh, good. So this is just one page of it. And it goes through a whole lot of pages. Talking about the sales, because I do charge for my time. And so when I tell a patient what the price of all of this is going to be, there is a little bit of sticker shock in our area. I mean, if I was to tell you what I pay, you can ask me, what I charge. In my area, it's a lot of money. In your area, it's probably not. But I do charge for my time. And so as I charge for my time, this gives you so much information to go through. And if they don't want to do this because they are not sure, actually see Virtual Clinic, because they have a free webinar that will take you through the differential, the CBC with differential. Because if you look at the differential portion of the CBC, you can actually get indications of dysbiosis on there. And it's super cheap, super easy, and you can say, oh, hey, look, your lymphocytes are super high. Why are your lymphocytes high? They're not supposed to be high. You really need to do this test. So you step them into it. And so, Denise, do you remember what that's called? Amy, can you give her the thing if she knows?
The CBC with diff?
No, what's the file called? Dr. Kiley goes through it?
The video?
Yes.
Yeah, Dr. Kiley's CBC with diff golden nuggets or something like that.
So if you go on to their website, there's something that will help you immensely. If you don't already know it. If you know it. So, macroscopic. We spend a lot of time on this. I just earlier this week was presenting to a bunch of business leaders in Columbus, Indiana, talking about foundational health. So here, some of you know this, some of you don't. I'm just going to throw another thing out there. America is roughly 4% of the world's population. Who knows about how many deaths from COVID there were?
That's a trick question.
So what was recorded by the WHO, CDC, whatever, go check it out, 7 million, just over 7 million deaths worldwide. What percentage, and she's right, there is a little bit of flubbing on America's sidelines as to how many deaths we had, because there was some, I guess I shouldn't get political, so America was 1.2 million of those deaths reported. The CDC asked why. So that puts us at 17%. So why were we 4 times more likely to die than any other nation? India was the next highest at 500,000. So we were twice of what India was. CDC said, why? Why do we have the most expensive health care in the world and we have the worst ROI? And they went in and they saw, we carry basically 4 comorbidities. Doesn't matter which ones, just pick them. They all increase body burden, diabetes, high blood pressure, insert whatever we hear about now that there's a magic pill for. So we spend a lot of time on this, and I tell people, I start with the basics, and I always have books for them to read. So Matthew Walker's Why We Sleep. If it's one of my run and gun guys, I give him the SEAL book. I forget what it's called, but Dr. Kirk Parsley's book, so whatever his book is called. But it's about SEALs and why they were underperforming, and it was all because of sleep. And I just basically tell the patients, you should be able to sleep unaided for 7.5 to 8 hours. They say 8 hours plus or minus 30 minutes. And if you're not doing that, you're not going through enough sleep cycles that you're actually producing your hormones. Who in here hasn't seen patients with hormone issues? That's the first thing we attack when we look at stuff. We do the Dutch Plus first. And then Jessica gets to go through the whole little, well, this is what's happening to you, and we get to go over the cortisol curve. That's my portion, is the cortisol curve. She loves to dive deep into here's your estrogens, here's your testosterone, here are your things, and this is how we're going to help you fix these. We start with orals first, trying to be very easy with this, but sometimes we have to send them out for the pellets. We don't do pellets. We have trusted practitioners that we work with that do all the pelleting and stuff like that. Next is nutrition. If you watch our 7 o'clock talks on Facebook, or if you go to our YouTube page, I don't know, I think we got 500 or 600 hours of talks on there now. And you're always going to hear nutrition. You're always going to hear the cop out of, it's got to be organic, it's got to be clean, you want to know your farmer. It's the stuff we all say to them. I mean, I'm not telling you anything you don't know. And if you don't know it, hit me up afterwards and we'll go have the talk. Movement. Wow, this is a hard one. I have offloaded movement to the Morpheus device. Who has used the Morpheus device? So the Morpheus device, for my area, it's $97 for this chest strap. It does a dynamic zone 1, 2, 3. I used to race for Polar, I guess semi-professionally, however that works. But they gave me all my heart rate monitors. They sponsored me in races, and I just had to wear the pretty Polar stuff. And so I have always done heart rate training, but they make it very easy and very digestible, and they gamify it for regular people. And it's a one-time fee of $97. There's no subscription. It will show them what their heart rate variability is. It shows them, hey, this week you need about this much zone 1, this much zone 2, this much zone 3. So then it gamifies it for them. And then they get to see what they like to do their zone 1, zone 2, zone 3. And it's not me being the mean doctor who loves to exercise anyway and does all kinds of stupid stuff to hurt himself. Stress. Stress goes back to our first nugget and our first test, which is the Dutch Plus. Because if you don't control stress and you don't give these people a way to deal with stress, and you don't use, phosphorine to bring them down or licorice root to bring them up, if you don't give them that help, they're not going to have the energy. They're not going to have, the great thing about the Dutch Plus is it also gives you the neurotransmitters. So you also know if they need amino acids. So then you can fix that energy problem. I don't want to get up. I have no motivation. You can really start to address that for them. And then last is community. As doctors, sometimes you have to build a community that they can come to of positive people that lifts them up and doesn't tear them down. You also need to look at them and say, hey, if your friends and family are always complaining and bringing you down and making you feel bad, well, you can't really do much about the family except limit the amount of time that you spend with them. But your friends you can change. And we recommend that a lot. Proteolytic enzymes, I like it easy. So I like the proteolytic enzymes. But are there any products out there? I also come from the Kalish school of thought, which is use a product that has multiple ingredients in it and then get a couple specifics. And then that way you have a very well-rounded protocol. And so what do we know that has like oregano and uva ursi and golden seed? There's a whole lot of products out there that do that, and I'll show you what I use. The proteolytic enzymes, IgG 2000, if somebody's is really tore up, the IgG, colostrum, those types of things do a really good job of binding to lipopolysaccharides. And you want to see a depression case come around. If you got somebody that's got gastrointestinal issues and they're just in a funk, clean up their diet and give them some LPS binders, and within 3 to 4 days, if you've dosed it properly, they feel pretty good and they're pretty happy. And they're really willing to do whatever you want them to do to make themselves feel better, because they've also got hope at that point in time. And how many times do patients come into you with no hope and they don't want to do what you're telling them to do because they've been to umpteen million other people and they've never gotten hope? So this is Transformations protocol. They have it for you. It's in all the booklets. If you have questions, Amy's my guru. Amy's the one who holds my hand through all this stuff. So she can hold my hand through it. She got you all covered. This is what I do. I start out with protease, 2 caps, 3 times a day. I don't start on an empty stomach. I have them take it with meals. I want to restrict what the dysbiotic bacteria have access to. Some people like to fast. Some people like intermittent fasting or time-restricted feeding. If they're at that stage, that's what I have them do. Once they start to feel better, then we go empty stomach. Gastro, I don't want to make it hard. I have a lot of people who work 12 and 14-hour shifts, and if I give them this really intricate dosing schedule of you take 2 of these here and then you wait 20 minutes and you take a couple more now and then you wait 2 hours and then you can take this binder and then you got to wait 2 hours on top of that so before you can eat again, they're not going to do it. So I keep it very simple. In the beginning, these 3 are all taken together when they eat. And then as they feel better, we start to slowly work on the biofilms. I work on biofilms the whole time. If I see the GI map give me that indication. And why is that? Because you can't get rid of them quickly. If you hit them hard and fast, what do? I'm not coming out to play. That's scary out there. And they stay in the snot ball. But if you hit them a little bit, that was uncomfortable, but I'm okay, and it just keeps on. It's stripping it away, layer by layer by layer. And you're doing it the whole time. If they have GI issues, your patients figure this stuff out for you after they've been on it a while. What do they say? Well, I started taking that gastro when I ate again because I was getting the bloating back. Okay, well, stay on it. Don't change it. We want to address that because we want to do a second GI map. We want to know where secretory IgA is. We want to know what the dysbiosis looks like. And then the Biocide and BioClear program, 3 months of that when I reach the killing phase. "52-year-old male, skin, rashes, itching, weight gain, can't lose weight, no energy, bad gas, acid reflux, high blood pressure, pre-diabetic." And honestly, that doesn't look that bad. I mean, you got 4 or 5 high. I'm kind of jaded because I've seen a lot worse. So start the protocol, started the hormones, started our foundational. I put everybody on a multi-pack with 2,000 milligrams of EPA DHA. I generally will do some form of a test to see what their omega-3 index is at. If it's really low, I'll bump them up to where I can get them into that 8 to 12, so they're anti-inflammatory in nature. This guy was no different, but that helps quell the inflammation. So he started the multi-pack. He was doing lipoic acid and Stellar C. He's in and out, off and on. We all have those patients. And I'm just like, it's no pressure, no stress. You know, I would like to see you at this point in time. If I don't see you, hey, we'll see you when we see you. But I did see that he kept ordering, so I know he stayed with it. So I don't remember how long after this was. This was maybe 6 months, 8 months afterwards. And look at this. And I see this almost every time. We've pulled that snot ball apart, and everything that was in it is now floating around and out and about. Now, this isn't a blood test, so I'm not culturing. I can't actually prove that. I've just seen it enough that I sit here and say, that's how I rationalize it. So, but MSQ went from like a 147 to like a 23. So it looks like this, but he feels great. So we do another lap around the matrix, as the Institute for Functional Medicine says. Am I done? Yeah. Okay. Real quick, here he is on the last one.
Thank you, Dr. Miller. So because of time...